from the Second Age of Reason. I'm here today to talk about healthcare reform in America again. There currently is a great deal of confusion in the matter, and I'm just trying to help clarify some things. There are more than one bill before Congress. There's the Obamacare, H.R. 3200. There's the Medicare for All, H.R. 676. There's the Baucus Plan, and I think there's something else called the Patient's Choice Act, and there's maybe even more than that. But they keep taking bits and pieces from each of these, running them before you, and spreading confusion and fear and misinformation. So the key is to know what some of the requirements are. A few weeks back, the president came out and gave a speech what his requirements were for health care reform. He named each one and addressed each of the concerns appropriate to that health care bill. He talked about each one, and during the process, one of the congressmen shouted out, "He lies." That is sort of ridiculous because he hadn't seen the finished bill yet. He hadn't signed the finished bill yet. There is no bill yet. So it can't be a lie until he signs it. And the bill that he receives will have been put together by Congress. So if there's any lies in the bill, it's lies where Congress failed to meet the expectations of the president in regards to what it should or should not do. There's also been debate about things such as coverage for illegal aliens and abortion procedures and whatnot. This is getting more into other laws, and by bringing that up, it simply muddies the water and confuses people more. The key should be that you need to separate clinical practice from the finance, because when you bring up things like illegal aliens and abortion things, you're getting involved into the clinical procedures and interfering with the business process, when all you need to address is the financial part of it. How do you pay for it? One of the other requirements was that it would not add to the deficit, and they are saying it's unreasonable to expect that. But the way I see how he could do it is if you mandate insurance for everyone with mandatory insurance, you have the premiums of 40 million people added to pay for it, and it's actually then managed through the insurance companies. So that's how the process gets covered without any expense of the government, by people paying insurance companies. Unfortunately, I have a little problem with that, in that instead of paying like a Medicare tax and getting Medicare, you're paying premiums. Now, mandatory premiums, if they are mandated by the government, to me are just another form of tax. And in this case, the tax goes to the insurance companies. With the government, at least, we have a say. We have representatives, we have senators, congressmen, and all that stuff. With insurance companies, we have no representatives. So in which case, we've lost a voice there. And so my motto would be, no premiums without representation. That the patients should have representatives in the insurance companies who decide what the insurance rate should be, just like Congress determines for the government what the taxes should be. So that's where I come from. No premiums without representation, especially if they're mandated by the government. So that's kind of where we're at. At this point, I would suggest there are insurance companies, pharmaceutical companies, and other interests pouring millions, hundreds of millions of dollars at Congress to influence their actions. Who is not represented is you and me and the people that be. And we need to let Congress know what we expect. I would urge you all, if you can, to contact your congressman, your two senators, your representative, and tell them, what do you expect? You don't have to name which law. You say, I expect to be able to walk into a clinic and get care. I expect to be able to go into a hospital and get surgery. And I don't want to have to see a bill. And I expect it to cover medicine, the one-time medicines for a problem, or maintenance medicines for a thing that is recurring in your life. I expect it to cover mental health care. I expect it to cover accessories such as maybe wheelchairs or crutches or scooters or whatever the case may be. You expect it to do this and cover that. Let them know what you expect, how it should work. You don't want to pay deductibles. You don't want to pay co-pays. You don't want to pay co-insurance. You don't want to pay that. You better let Congress know, because they're making the rules now. This is the time. This is your time to make a difference. Let them know. If you don't, the insurance companies are. So I'm leaving you with that right now. So please contact your representatives in the government, in Congress, and let them know what you expect. Thank you.